This next section is going to talk about different ways to modify exercise if you do have chronic pain. Because of course, since we did just discuss in this last section, we should exercise. Okay, how does that might look? The first thing I want to touch on is exercise selection. When it comes to exercise selection, we can first look at our warm-up. If you're somebody who's dealing with chronic pain, you might want to have a slightly longer warm-up than normal. This could be something like walking. It could be a light dynamic exercise like going on a bicycle. You could do some light dynamic stretching, so reaches up to the sky, reaches down to the ground. You could do some body weight exercises like lunging with a stretch. There's so many different types of dynamic exercises. You can probably find some on my channel. Otherwise, you could probably look online too. Just type in dynamic exercises into YouTube. There's a lot of good resources out there. In addition to that, doing multiple warm-up sets of whatever workout you're going to be doing is extremely crucial to hopefully help to improve some circulation through that area. So that's going to get some blood flow. That's going to get some nutrients through that area, more so if you are experiencing pain by doing this extended warm-up. But also, again, it's going to retrain your brain to help you realize that those specific movements are okay. It's going to help you not catastrophize and overthink the pain signals that may or may not be happening during that movement if you are giving yourself a little bit more time to warm up those specific areas. So the first point in modifying exercise for pain is making sure you're giving yourself a long enough warm up and doing ideally a warm-up that's very, very gentle. I like doing some stair steppers sometimes. I like doing an exercise bike. Even just walking on the treadmill, just getting a little bit of blood flow, nothing too crazy, will go a really long way overall in managing your chronic pain when doing exercise. The next portion of this, we can talk about kind of different exercise selections. So one of the things that people often have when dealing with chronic pain when exercising is potentially arthritis. And arthritis can be made very, very much worse with higher impact activities. With that said, I don't want to get people to realize that all quote unquote high impact activities are bad. High impact exercise activities are not bad if you're not dealing with chronic pain. And actually, if you do have chronic pain, trying to get back to a point where your body's strong enough so you can do higher impact activities is extremely crucial to remaining independent and overall pain-free through the rest of your life. So that's kind of a caveat. That's a side note I want to mention, that doing something like running or jumping isn't inherently bad. It doesn't inherently increase pain, but if you're not used to the overall demands on it, that definitely could increase the overall pain that you're having with exercise. Tie that in a bow, bring that back in. Lower impact exercises and activities might be a better option for people who are dealing with pain, simply because those higher stresses, higher workloads, those pounding activities might cause a little bit of aggravation. They're very, very intense. So a few different lower impact exercise activities. When it comes to cardio, we'll talk about cardio first. Stuff like swimming, biking, walking, rowing. These are all great lower impact activities that can help to improve blood flow and circulation through your body immediately, which will actually greatly reduce the overall pain in your body, simply because you're getting some good nutrients to those different joints, to those different areas. But you're also doing a consistent low stress movement. So for example, if you're having knee pain and you get on a bike, not only are you getting blood flow to that area, but you are constantly bending and straightening that knee multiple times. That's in a very low impact way. It's not a large range of motion, but it's a range of motion, and that shouldn't be overlooked of that specific movement. So doing these little movements can help to kind of work you towards that catastrophizing less that we talked about earlier, kind of getting your body used to doing a movement and realizing, okay, this isn't going to cause pain. Doing some cardio is a great way to do that, specifically those exercises we talked about. So walking, running, swimming, biking, all of these lower impact exercises. And this could be something where you even use this as part of your longer warm up. I think that's a great idea if you're dealing with some chronic pain. In addition to this, when it comes to weight training is incredibly important to help reduce some of your chronic pain by strengthening the ligaments, tendons, and muscles in your body, keeping you independent in your daily activities, which is really, really crucial. And by actually strengthening the muscles with resistance training, you're able to hopefully manage this long term. Again, as we talked about, physical therapy literally is resistance training for the most part, just at a very toned down volume. So when we're thinking about modifying weight training for exercise with chronic pain, we want to use something that has probably lighter weights. This is usually done in physical therapy, so something with lighter weights, focusing on really good mechanics, almost, perfect mechanics don't exactly exist. Everybody's a little different, but as close to perfect as you can. Lighter weights, lots of repetitions. In addition to this, doing something with machines might be a good idea, simply because there's not as much stabilizing going on. So it's a little bit easier to kind of keep your joint in a specific place so it doesn't get jarred out. Say if you're doing like a front squat, for example, or a back squat, and you have lots of load on your back and you slip and it causes a large amount of overall pressure on your knees simply because it's a free weight exercise, it's very challenging, that can increase the pain. So when you're first starting out and going back to these things, doing stuff like machines is a good way to work really, really high repetitions, to actually work almost perfect movement patterns, because those machines are actually kind of locked into place of what you need to do. And this can be an overall really good way to decrease some of your chronic pain when you are exercising. Also, resistance bands, I think, are a really great tool that you can use to strengthen the tendons, ligaments, and knees if you are dealing with chronic pain with exercise. And this is because you're able to ultimately do a lot of repetitions with them. And as we talked about, when you're dealing with chronic pain, trying to do a lot of repetitions to build some of that tendon health, to build some of that ligament health is very, very crucial overall. So resistance bands might be a great option. I would just stick with stuff that's really higher repetition, trying to feel the body move, feel the movement. We can use squat, for example. Maybe you're doing a leg press and you're just doing a very light leg press for a lot of repetitions. This is going to be your best bet. Ideally, over time, you want to try to build into maybe a little bit more strength exercise. That's a really good idea. But when you're first dealing with pain, this might not always be possible. Also, another thing that might help to reduce some of your pain is some light stretching activities, and I would do this after your exercise routine. If you do it before, this can decrease performance. We talked about doing dynamic stretches like reaches to the sky or like a knee to chest exercise before. That's okay. But actual static stretching, like reaching and holding a position, that can actually decrease your performance. It won't really mess with pain very much, but afterwards, stretching is a really good option because you're passively moving your joints through a range of motion. It can help to reduce some of that stiffness that you might be having. But I do want to say that stretching isn't inherently magical in reducing your pain. Stretching itself won't literally reduce the pain. Doing all of these things together, as in doing a very long warm-up, doing some strengthening exercises, all of these things together will help you to reduce the pain. The stretching is a nice added touch, but it isn't a quick fix. A lot of people will do stretching because they think, oh, I have knee pain, so I'm just going to stretch and it's going to get rid of it. It may immediately in the short term because those muscles are tight, but if the muscles are tight because there's weakness in the area, if the muscles are tight because you haven't been paying attention to it and getting it stronger, that's a totally different story, and why overall exercise in general is really, really important. Another way that we can address modifying exercise with pain, and I kind of talked about earlier, is doing movements that indirectly work a joint. we're going to go back to the bike, but we'll use the hip for example. So if you're having hip pain and squats hurt, for example, or the leg press hurts, for example, but you get on the bike and the bike feels okay, that's amazing. That is amazing because if you think about it, the bike is using a lot of different of your hip muscles the entire time. It's literally extending and flexing your hip numerous times when you're on that bike. So because of this, you are passively, actually actively, working your hip in a very small range of motion, getting some blood flow through that area, but it's not causing you pain. It's not causing you pain, so you're finding a movement for yourself where you're able to move without pain. This is a really good rule of thumb when modifying pain with exercise, is to find movements that are similar to ones we want to do that don't cause us pain. If walking causes pain, maybe we can try doing an incline walk that's a little less intense. Very similar movement. Hopefully you can build some strength and stamina in that movement over time, and then you get to a point where you can do normal walking again. Maybe if you're somebody who likes doing overhead press exercises and that's causing you pain, but you can do a bench press okay, so pushing something in front of you, we can try doing some bench presses to kind of get your body used to moving in those areas, keep those shoulder muscles strong. But going back to what we talked about earlier in the podcast, it's very psychological too. So if you're able to do bench press without pain and your brain can tell your body that, hey, I'm strong, I can get through this, there isn't any need to overall stress about my pain, that's going to decrease the pain. It is somewhat in your head. And again, as I discussed earlier, not all pain is actual tissue damage. It's a large amount of different things. Very, very crucial point to note. When it comes to volume and loading of exercise, what I always tell people too is to do as great of range of motion as they can without pain. So when we're going back to our knees, for example, this is somebody who might actually have knee pain when they're doing squats. And if somebody has knee pain when doing a full range of motion squat, I might say to them, hey, instead of that, let's just try to do maybe a half squat to begin. Maybe we can even do a quarter squat. Trying to hopefully build that squatting pattern, build that overall muscle strength and mass over time to then go down to a full range of motion squat eventually. This is kind of the name of the game with all of this. We're trying to build up slowly, long term, from these various different ranges of motion. So as we talked about with physical therapy earlier, this is kind of what you're doing. A lot of people, you might go in and not be able to do a full squat. So people, maybe they'll just be doing sit to stands, as in getting up and out of a chair. This is very, very frequent. This is a modified version of a squat to hopefully build you up to doing a normal squat without pain. Starting incredibly low is probably one of the best things you can do when it comes to overall weight and volume. And I want to describe this when I'm thinking about back pain. So if somebody has back pain, for example, and they want to deadlift or practice picking up something off the ground, I want you to reframe what a deadlift is. All a deadlift is literally bending over, grabbing something, and picking it up. You can do this without any weight. You can deadlift literally a pencil. And if all you can do right now is bend over and pick up a pencil to get stronger, that's where we're going to start. And that's okay. That's still technically load. It seems silly to say it that way, but that is still technically weight. And if you are able to, say someday, do 2 pencils, 3 pencils, 4 pencils, maybe you're now to a 1 pound weight, this is the idea of exercise. This is just adaptation in general. You're adapting your tissues and structures in your body to get used to being strong enough to do that specific movement. Another thing that you can do when talking about exercises is consider doing isometric exercises where you're not actually moving through a range of motion. So a plank is a good example of an isometric exercise, maybe like a squat hold. If you have knee pain when doing actual range of motion squats, you could do something where you're just holding a half squat for 30 seconds. it's still working that movement pattern of the squat. You're still going to build a little bit of muscle and strength, not as much as, of course, a full range of motion squat. But again, this idea of when we're having pain with exercise, we're trying to build the movements, we're trying to get our body associated to actually moving pain-free again in a way that's not painful. And that sounds kind of like duh, but that's the idea. That's the idea with physical therapy, and that's the idea that I always try to prescribe with the individuals that I'm working with. Being conservative with your jumps is incredibly crucial as well. Again, you don't want to go from having knee pain when doing squats or leg press, for example, to doing a bunch of repetitions with no rest in between. Basically, we're trying not to increase our overall workload too quickly. We're trying to ease ourselves into it very, very slowly. So long story short, over time, we want to increase the loads, but it's not going to be as quick as somebody who's not dealing with pain. We are still going to try to progress. We are still going to try to get better, but it's simply going to be in a way that's not as intense. In addition to this, we're trying to desensitize the movements of pain. So by doing a half squat hold, if an actual squat causes us knee pain, we're able to desensitize and get our body used to moving in that way. And you're telling your brain, hey, there's really not that much issue that's going on. I don't need to think about this. I don't need to worry because everything is okay. As we talked about earlier in the podcast, and I've repeated this numerous times, but it's so crucial. If you're having pain doing specific movements, there might not be anything wrong, and catastrophizing and thinking about it will greatly increase the chances and the pain signals that come through your body. We're trying to build strength, build confidence overall long term,